Thank you, Dr. Ankita and Sahani sir. Good evening, good afternoon, and good morning. This is the 1360th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all of you to the session. Today, our guest is Dr. SADAT SAIT from Kerala. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know that International Forum for Promoting Homeopathy was formed by a group of homeopathic lovers along with the students and homeopathic doctors. And we have a presentation from doctors as well as students as well as from eminent personalities from different sections of the society. And the purpose of this organization is to connect between doctors among the world, as well as connect between people who are who loves homeopathy, and we want to promote homeopathy by way of this kind of webinars. Thereby, the sessions will be reaching to the public, and the public will be watching what is happening with homeopathy in and around the world. As today, we have a guest in Dr. SADAT SAIT. He has completed his BHMS and is running 2 clinics in Cochin, Kerala, as well as in Alva, very near to Kerala, very near to Cochin. All these clinics are running in very high mood, and he has an experience of more than 27 years, and he has shared a lot of presentations in this forum. And all in all, a very a fine session is going on by way of his presentation. He has done presentation in 3 of our forum. That it means he has presented presentations on at Hindi, at English, as well as in Malayalam. So that's the kind of personality. He is one of the most wanted personality in our local language session. And all presentations made by him are excellent. And he is a person who was a teaching faculty member at our organization and the Institution of Homeopathy Kerala. And thereafter, he has worked in various organizations as in big as topmost abilities. Tom was he was working very recently as the General Secretary of QFA, that is Qualified Homeopathic Doctors Association. So that much of effort he's taking to protect and promote homeopathy. So let us welcome Dr. SADAT to the session. Dr. SADAT SAIT today presenting a session on management of ulcers with homeopathy. As you know, this is one of the area where homeopathic doctors can do wonders, as well as this is an area where the public has no much idea about what homeopathy can do. So this will be a rocking session tonight. So let us welcome Dr. SADAT. Welcome, doctor.
Thank you, Dr. Danesh, for a lovely introduction. I don't know how far it will be a session for that. He has introduced me and took me to the heights. And thank you so much. But let's see how things are working out. Everyone knows that we'll just get into the session faster. And today, can you see me, everyone?
Yes, everyone, we can see.
Okay.
But a little bit of shade in your face, and there is
Okay
not,
now?
not much of brightness in your face. It is better to adjust your camera to the light to ISS. Now it is a little bit more clear.
Okay. See, let me start the class. Let me introduce things. Ulcer, you know, everyone. If there is any cut anywhere, it is called ulcer. The reasons for the ulcer is entirely different. Reasons can change with the diabetes to anything. So let me start with the gangrene ulcer, recently treated, maybe around a month or so, so that it does not come into my presentation. I think you can see this. This is a video. It's a. Can anyone see? Everyone see?
Yes, yes.
This is a case of an ulcer of the right thumb. Okay. This
Okay.
is a case of Raynaud's disease. The ulcer and gangrene fall on the right thumb because of the Raynaud's disease. It's a case of mother of an Ayurvedic doctor. She had come to. She had not even come to me. She had sent me the photos and asked me, "What can you do?" She is from Tamil Nadu. That must be around 300 400 kilometers from our side. So this is only with the camera and the whatever the photos she has sent it to me. Okay. At times, what happens is we don't know the medicine. We don't know what is the situations. They just send photos and they wanted medicine. We can ask the medicine through the phone, or you can ask the contact them through the phone. That's all we can do most of the times. Sometime, at least sometimes, because patient is far away. Online consultations are more. Now we are doing Zoom. We can do the Zoom, and this is the photo. This is healed ulcer, Raynaud's disease. It is due to the lack of blood circulation to the fingers because of the constrictions of the blood vessels. Especially happens in females. Okay, this is the case when it came first. Okay, this is the photo, healed case.
Great.
Okay, this is just in a matter of 2 weeks. And this case was referred to a surgeon and they wanted to take away that slough and clean it up so that that finger can be saved. This is in 2 weeks time. We have done it. Medicines, I will explain it to you one by one. Okay. Okay, now let me start my PPT because I was so excited because this is one of the rarest cases where homeopaths get it first of all. Raynaud's disease, they go into the surgeon and they spoil the cases. I have seen in my own mother's case Raynaud's conditions with SLE. That time I was a fresher, couldn't do anything with it. Now that cases has haunted me because I couldn't do anything seeing my mother's fingers one by one getting dried and the phalanges goes off. By the time she is died, she didn't have the 3 4 fingers. She never had. She didn't have the what are called the phalanges of the hand. It can happen in a leg also. It can happen in your hands also. But I couldn't do anything. I was just a spectator. And I've tried with my seniors. They said they also don't have any experience of treating such cases. Now I am at least privileged so that I can treat these people successfully. Over the years, it took me over the years to explain it to you, or I can show the cases. That is why I took this case as the first thing to show it because it was little dear to me. It when I got this case, I took it as a challenge, and because it has hurted me so badly when I finished my homeopathic courses. Okay, can you see this case?
Yes, yes, yes.
Okay, this is a case of diabetic ulcer. It is a case of a doctor only, homeopathic doctor here in Kerala. So that I have not put the name of it because he's a very well-known doctor. I don't want to reveal any identity of this case. Most of the people might have seen this also, but the case is diabetic foot. It came just like this. Okay. First photo was just like this. There was nothing. It's a small ulcer, small ulcer. But when the worst part is that he didn't know there was an ulcer. When he came to me, it was like very offensive to the core. So once we started cleaning it up, it has become next one level, then the third level, then the fourth levels, went on. Okay, this was the first one. This one was the first one. Okay, these are the different stages of healing. See, the ulcers are healed. This is the leg. This one. Okay. This is the healed one. This is the first one. The second case. This is the stage when he came to us first. It was too offensive. No one even could stand it, but he didn't realize that. He didn't realize that the wound is so deep. That is called diabetic ulcers. We have to be very careful in dealing with these cases. Okay. This is the diabetic ulcer stages, and it has healed. The last picture is of healed ones. Okay. So one by one stages it's coming up. It is healing, 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 and this is healed. Okay. Another one. I'll show the pictures. You can see the pictures first. Explanations can be, this is also another gangrene, diabetic foot, gangrene. Okay. This is also again a surgeon referred to for the amputation of the leg. See beautifully how it heals. See the stages, first stages, second stages, third stages. See the pictures. How wonderfully it heals. See, this is the condition when it came. Few of the conditions it came. Okay. See the condition it has healed. Even the nails have been intact. It has come up. It is wet gangrene. See that gangrene heal going this. That skin is going out in this. You can see this. Okay. See the healings. See the stages of gangrenes. Okay, different stages of diabetes gangrene. This is his reports. Okay, it is supposed to be Doppler study. Everything is there. It's well documented case with low circulation of the feet with diabetes, and see the difference. This is the healing. We can do it with homeopathic medicines. I will explain it to you once the cases are over, photos are over. One each cases I will explain it to you separately. Which medicines have been taught about it, how it is, how did we dress it up. Everything can be explained. This is case number 3. Different stages. Okay. See, it's healing. This is one of the very difficult cases because it takes a lot of time for the thick skin to come close. So different stages, this treatment is still going on. So last stages, I have not taken the photos. I'll take it little late. Okay, 3 cases I've shown you, and I will explain it to you. This case also. This is something. Oh, can you see that small? This one. It is a snake bite.
Yes, yes.
This 2 rounded. It is a case of snake bite. Okay. This was a wonderful case. She's a patient of mine from long time, and once she went into the surrounding out of the house, she was bitten by the snake, and snake was identified as vipera. Viper was she was bit by a viper, and they took it to the hospital, and after 1 or 2 hours there was no snake venom there. So 1 or 2 hours of observation, she said, I wanted a discharge, and she came to me. Okay, I still really don't know what confidence she had on me. She wanted an immediate discharge from the hospital, and the hospital informed the police. Police came to the my clinic, saying that there was a patient called this person who has come to you for the snake poison. What is the state of affairs? So next day, okay. So it was a wonderful session, and it was healed in 3 days time, 3 4 days time. Now also she is coming up. Okay, this is wonderful. I will explain it to you all the medicines which we thought about it. It is seeing is believing it. I also never thought that patient has this kind of a belief in us, homeopaths, for the snake bite. A multi-speciality, a big hospital of almost 400, 500 hospital, bedded hospital. She asked for a discharge from the casualty after 2 hours of rest, came to me, and she is better in 3 days time. That is something which is even I couldn't digest till now, but we did it. It was the biggest risk of my life. But she trusted in me. The trust I had to fulfill, and that's it. We could do it. This is also another diabetic food. There was a nail went into this. Even when he was wearing a shoes, nail went into it, and it got uh, gangrene. See the case. Okay. Patient name is Philip, age 50 years, location Alva. It's also doctor's husband. This is fourth case of an ulcer. See the photos. Picture says everything. I don't have to explain anything on this. Right? Seeing is believing. I don't have to even open my mouth about the healing process of homeopathy. What homeopathy can do on these ulcers, diabetic ulcers. And how I got my confidence on this is I had ulcer in my own clinic, my own leg. Went into different places. Went into multi-speciality hospital first. They said that ulcer has to be slough has to be taken out. I have to be taken to the GI I have to be given general anesthesia, and it has to be that slough has to be taken out. Then that wound has to be made bigger. Then you have to clean it up. You have to be hospitalized for 15-20 days or something of that sort. That this I got fed up. I said, water come, whatever, I will not do that. I cannot go 15 days, my clinic will be suffering. So I just came to the clinic. I started dressing up myself. Wound. I went to the homeopathic hospital in next nearby. They also tried 1 or 2 days, and after that I couldn't go there. I tried myself dressing up along with our medicines. That's how. That time I never thought that that has to be taken. The photo, that photo has to be taken, or we were not too good in this. Corona taught us to be tech savvies. So these are the finest examples and finest things we can give you on this. Okay, this is another varicose ulcer cases. A Princey, a diabetic patient again. See the legs here. It's I don't have to even talk anything on it. All right, you can see the pictures. See how beautifully it is healed. Okay. I had asked her to be on live today, but she couldn't connect it. This is Princey. She's a diabetic patient. Once it healed, it occurred one more diabetic plus varicose vein also. So both together was a complication. See how it has healed. Photos are there. You can see. Okay, see the healed leg. Hope you can see this photos.
Yes, yes.
Okay. This is ulcer case. Two more cases I wanted to present it. Uh, Here, I just don't know whether this, because it's one of the few rarest cases where we don't get it often. It's not an ulcer case, it's something entirely different cases. The patient of this age, she walks on toe. That boy walks only on toes, toe walking. And this is something which the patient's mother has written to me. It's a homeopathic doctor. She has written a Facebook. This one, I have lot of videos of this boy. Okay, and you can check Dr. Sujina Robin. She has given it in the Facebook also. The boy walks now on foot without any surgery, without anything, only homeopathic medicines. Okay, this is something, a case of renal calculi. It's nothing big deal about it, but the big deal about it is this girl is only 30, less than 30. This lady is just less than 30. And she used to often, repeatedly get this calculus. Three surgeries done. This is the fourth one. They are fed up of the surgeries. Then they came to me. In 3 days' time, calculus come out. We did a scan, bilateral renal calculi. Now there is no scan. She is not reporting to me. She is my cousin only. I met her yesterday also. She said absolutely fine, no pain, nothing. So I asked her to do a repeated scan. What happens is once the patients are better, doctors are doctor's profession is a thankless profession. Once, once everyone is okay, we don't know. But for us, every patient healing and getting into the real life is an amazing feeling where there's no money matters, where there's nothing matters, only healing and in front of us seeing it. That is something which, okay, I'll get back to the first one. No theory. Theory is nothing in front. When the patient comes in front of us, only cases are there. Theory, we can take the cases of detailed one. We will get the details. The first case was a Renault. Whatever I could elicit is there's nothing, no history. When we ask general this one repetition, mind nothing. She's all right. She's happy. She's not this. She doesn't give too much of cases, and they don't know why we are asking all this. One small ulcer on the hand. Why do you have to ask too much of the cases? The first case of Reynolds disease. My prescription is also always Vipera. Then I had given CKL core plus lacusis. Lacusis. At times we can think about plumber met. Plumbum met because of the Reynolds disease. 4 medicines I have given her, asked her to stage by when 1 week I told her to take Vipera. Second one, I've told her to take this one, CKL core. Once the healing started, the first one was Vipera because she was worse when the hands were hanging. That was the only symptom I could elicit. Hands were hanging. She was having severe pain. That was the only symptoms we used to get it. So that was the first thing, Vipera, because cases are very far, so I had to keep other medicines also ready. I cannot keep sending the medicines. The first Vipera, it started healing. Once the healing started progress, and after 2 days, it stopped. It was not getting into the next stage. It was not coming healing properly. So thought about plum pump because of the slowness and stiffness of the our blood vessels, and it could be stiff and contracted stuff because it was not dilated, because it was not dilating aplastic look or aplastic theory of the plum pump. Okay, so that was the case which let the flow started and the healing process started back again in 3 days time. Healing has started, and plum pump and this took care of at least 50% of the healing, and it got finished with CKL core and gunpowder. Okay, last stages were covered with the one gunpowder. And I have sent for calendula external. Ask her to just apply it without wrapping it up, so that the fresh cells get oxygen. I said don't wrap it up and don't put it into the water. That was the only thing which I could tell her, and they took care of the rest, and it has healed like anything. Now they started referring the cases to me like anything. Okay, this is a case of diabetic ulcer. This is a very famous doctor in Kerala only. Most of the Kerala people must have been knowing that doctor. So that is why I'm not revealing the case. Okay. The medicines we thought about is acid first, because we have to reduce the sugar level. Okay. Merc because of the punched out ulcers. See, every ulcer has a clear uh, boundary. Started with acid first to reduce the acid first tincture. I couldn't do anything without it. Acid first tincture to reduce the diabetes level, to control the diabetes level. Then Cesium tincture, see, not Cesium, Symphytum. Symphytum tincture always has that punched out and deep ulcer formation. Symphytum. Then the third one is Merc Symphytum. Then this healed with gunpowder. Gunpowder usually helps if it is in a carbuncle or anything. Gunpowder every time. Gunpowder 3x every time when we repeat it in this kind of ulcers, diabetic ulcers, gunpowder, gangrenes, wet gangrenes, gunpowder 3x or 30, whatever we can get it, 3x. Most of the time it helps in healing process. And echinacea tincture, I've used it plenty of these cases because of the pus formation. More the pus, echinacea is indicated than the calendula. Calendula helps and echinacea helps in forming the this one. Echinacea internally 10 drops 4 times a day or 2 hourly also given, and it is external also echinacea and curcuma. Curcuma, I've used my own preparation of curcuma, which I have made it into uh, made it in my clinic. Chopped it, put it into the RS or rectified spirit, and kept it for the few days. Then we took the essence of it. So it was direct and pure curcuma rather than we get it as a dilution. So that has helped me from this one, and the result is in front of you. And it's not easy. See, you are treating as someone whom I know and I have admired. I have always looked up on this doctor, a senior doctor who is trusting me. It's not an easy job to do a diabetic ulcer of this depth. Even I didn't know this when the skin was removed. I never knew this was the situation. And her daughter is also a doctor, so dressing was done at in the house. So, and this is the beautiful report. 4 5 medicines, we can heal any ulcers. And syphilinum is also one of the best medicines. Syphilinum, again the punched out ulcer, depth in the ulcer, painless ulcers. Okay, carbolic acid also can be thought about. I have used carbolic acid in other cases, not in this. Okay, carbolic acid also very good if the ulcers are in depth. This is also another wonderful case which has helped me in long way. Okay, this is also saved. Homeopathy could save from the surgeon's knife and taking and amputations. This is also medicines are the same. Syphilinum, again because of the ulcer formation depth in this and painless. It was painful also. Vipera, Silesian in 30 potencies, frequent repetition. Carbovage has helped me in different stages. I cannot say, I can say which stages which medicine can help you, because I cannot, if I write medicine's name, there's no point. Okay, that is why I'm not putting out the medicine's name, this. But this is the stage which we can use it for the gunpowder stage. See this first one. Okay, this is almost healing stage. Gangrene is getting healed and that skin is coming out. This stage, that skin is getting peeled off. It is that stage, that drying up means we have to see through the when this kind of a situation comes up, this pictures comes up, we know that muscles are getting dried up, or we can say it's getting died. Cells are getting died. From there, we will have to recoup that case. Okay, see the difference. Every stage. The medicines are same: gunpowder, silesia, echinacea internally, and that carbohydrates for the supply of oxygen. And whatever the medicines have to, Maxol will help you in such a beautiful way to heal this. Okay, echinacea internally will stop and prevent the further cellulitis and further uh, deterioration of the case. Okay, so medicines, anyone can treat it. Medicine, it's not the medicine only, it is how we dress the case. That is more important. Dressing of the case, taking care of it, removing the slough and the sludges, that is most important. Not even, you are not supposed to even keep one dressing that twine or that cotton inside. You have to be meticulously cleaning every little slough inside the this one. Luckily, this patient was a doctor. A patient's wife was a doctor, so she was doing it. Weekly, once or twice, she used to come to my clinic. So with that support and with our medicines, weekly we used to follow it up every day with the photos. And this is the result. And this is the healing pictures. Healed ones. Okay. Now he's a pastor also. So he is going for the prayer meetings, everything. Say this. Okay, it has healed beautifully. We could save that thing, little thing, toe also. This is the case. So this also, but this is taking little longer time because of the thicker skin on that, because it has come after years, 5 years of ulcers. Showing to different this one, skin grafting done, grafting taken away. So it is little time to heal it up, but it is getting really getting healed. See the stages of healing. It is not easy to convince the people, convince family, but there's no other go. Okay, this was the case. Okay, that was the case fourth. This is fourth case. Okay, case of snake bite, reported 4 days back, taken to nearby hospital at 1 p.m. on first discharge against reported me 12 o'clock on that second. That is 12 in the midnight. She called me to my number phone and I had to rush it. Okay. The medicine given was Ledampal 200, Vipera, Echinacea, Lacasis. You will ask me why all this? Because I really don't know what to do with this lady or what to do with this case. And I couldn't take any risk. Every 10 minutes, I had asked her to repeat, change the medicines. Every 15 days. And I was here with her in the, I changed the medicine every 15 to 20 minutes because she was in my clinic. Night, full day, I was with her. She was peacefully sleeping. In the morning, her clinic, her house is just nearby. So morning, she went home and back again. Third, she was better. Fourth morning, she called me up and said that she's feeling chest pain at night 10:30 p.m. Again, I had come, but asked her to repeat the medicine 1 hourly and reported next day at that same day morning, fourth or fifth day morning. She's also cardiac patient. She had a severe block. Maybe 15 years back. This patient is reported to me 15 years back. She had a cardiac block and she is much, much, much better. No blocks now. That case I will tell you later. But this is the case of to report to me with the snake bite. Medicines given was, see, this case is the fourth one. Case number 4, patient name is Philip, age 55. Location is this one. Medicines given as Silesia 1M, Vipera 30, Merxol 1M, Calendula Echinacea. Just 3-4 medicine. That's it. Echinacea, Calendula internal also, Echinacea external also. Because it was deep. You can see the wound. This was a pus formation again. This wound was, the first one was very deep. And the best thing is that his daughter is a allopathic doctor, but dressing was done with calendula and echinacea. She helped in dressing up very well. Okay, before coming to me, he was hospitalized, and after that only they came to me. His daughter was a allopathic doctor, so they helped me with the dressing with echinacea. Nothing, no other medicines, no allopathic medicine or no antibiotics was given. And the girl, she just passed out, has a 2 year or 3 year experience. And the girl trusted, her mother is homeopathic doctor. The girl trusted homeopathy like anything. Now the family is my patients. Okay. Medicines, just this. Just 3 medicines or 4 medicines. Vipera is one of the best medicines for this kind of a stuff. Silesia 1M. Silesia 1M because the pus was deep. It is called surgeon's knife. Merxol because of the punched out ulcers. and I had given her CGM also because of the diabetes, okay, to prevent the diabetes. This case, see the cases, how beautiful homeopathy can do anything. This is Princey, fourth patient. Princey medicine, Merxol, Silesia, Calendula, gunpowder, Asal. Hardly 4 5 medicines in different stages, maybe 2 or 3 different cases. When the starting comes up, sometimes we feel that on examination, we feel that healing is not coming up properly. 3 days, 4 days. Simple cases, yeah. There's nothing big deal we did it. But dressing is the best part of it. You have to take care of the dressing properly. In this case, again, same. You all know that the medicines. I'm not going into the medicine part of it. Everyone knows it. It's not a big deal. This case is little special to me because this is very difficult one. Patient's mother is a doctor, homeopathic doctor, but very anxious. All family first kid, and the medicine given was lateris and chamomilla. Chamomilla because mostly there are two chances. One is tendons are shorter. Okay, that could be one reason for this toe work. The tendoachilles, the tendon will be shorter, the muscles are very stiff, and lateris. If you take out the boric, it clearly tells in italics, walking on the toes. Only medicines. And chamomilla was given thinking that this could be some behavioral disorders also with the kid. You cannot expect, well, we cannot tell that this aged kid can have a behavioral uh, disorder. But chamomilla, after chamomilla, it showed a good improvement. Patient started responding properly for the lateris. Chamomilla repeatedly once in a week or once in 2 days, we had given it, and it complemented the lateris one. Only 2 medicines has been given, and physiotherapy and all the activities of whatever the ancillary measures with our own medicine are given for the massage. We prepare some oil for that for the massage. The oil is just Gulteria, not the tincture, Gulteria, camphor, and eucalyptus. Gulteria oil, original oil, not the Gulteria tincture we make it. We get it from Ooty. It's an original one. Original, we get synthetic also. This is, I have people, so I got it. Original Gulteria, camphor, and this one, camphor and eucalyptus. All three mixed in a 10 ml and put it in the oil and asked it to do a proper physio and massage with that oil. And this is the medicine. Sixth aphorism, Hahnemann has told ancillary measures are most important for the cases. Okay, I'm just stopping this uh, sharing. I'll come up with another this one. Can you all see this?
Yes, yes.
Okay.
Now stop.
Thank you. No, this one.
No, you stop screen sharing.
Okay, let me see that.
Reshare now.
Reshare now. I'll do that. Now.
Yes, yes, it is coming.
Okay, this is varicose ulcers. This is varicose ulcers. Okay. Again, I'm skipping all the theories of varicose ulcers. Let us go into the pictures. Patient is a shallot. She was an athlete. Varicose ulcer. Okay. See the healed ones. This is Princey, that old one. That Princey patient has shown, the last ones. It has come in this one. Princey 35 before and after. Clear cut pictures. This is the stage which I've shown you there. Every stage I've shown you. This is another case. This is a case of shallot. I think this is healed one. The third one where I cannot. Can I just. No, this is the after photos. Can you see? 3 photos are here in this.
Yes.
Okay. The first one, because I can't see because the video is there on the right side. So I couldn't see these pictures. Okay. So this is one patient called Charlotte. She's an athlete. This is another patient, Mary Philomena with ulcer. This is the graft. I think we'll have more photos of this. This is Princey. We have added into it. Okay. I'll just get you. This is fourth or fifth case, sixth or fifth or sixth cases with Charlotte with venous ulcer. It is healed one. See this pictures. Okay, this is Mary Philomena. Another cases skin grafting. First pictures are there in another PPT. I'll just check it out where it is. Okay, this is skin grafting of 10 years duration, and this is the stages of you. I really don't know where is the pictures. Okay, it is there. This is the pictures. It is healing up. I think another one. This is Princey, which healed up. So these are the pictures of every case. We have it now. There are few going on. Treatment is also going on. This is also Mary Philomena case. Varicose ulcer. So we have put it into this. Okay. So I think I have given you all the explanations of how medicine can help you in treating with the pictures. Few cases are going on, so that until unless we get the results, we cannot just put it in. That is why I didn't show it. Okay. The basic thing is diagnosis. What kind of an ulcer it is? Diabetic ulcer, varicose ulcer, or any other ulcer. Diagnosis is the most important part of it. Can I just stop the screen sharing?
Yes, yes, we can go for discussion also.
Discussions.
So you can conclude as per your will.
Yeah. So there's nothing more to tell you. Anytime we can take up the challenges of healing any kind of ulcer with homeopathy. Thank you
Yes,
so much for inviting me here.
yes, as I told in the beginning, that you really rock the floor with your knowledge and your successful cases. This is what a homeopathic doctor can do, because we have a lot of things in our kitty, but unfortunately it is not coming up, and nobody is noting all those things. So it is a time to publish all those things in papers. But as you know that the public papers, they need money and everything, but we can promote through this by uploading all those things in YouTube. And they all, what you all have to do is just to share it with your friends and groups, so that more and more people will uh, be able to watch what is happening with homeopathy, and how these doctors are doing such cases, and how we can deal with these cases also. What are the things we use during? Some people think that homeopathy cannot do any extra treatment for external diseases, but it is not a thing we can do, whether it be an internal, mental, physical, or even either of both. This is what Dr. SADAT SAIT has shown in this platform. Congratulations to you for your excellent and successful case presentation. Now it's over to Dr. Hibbert to begin the discussion.
Few people have
Uh,
asked about the potencies. See, basic potency is 30.
Thank you,
30.
sir.
Yes, tell me, sir.
Yes, you can control the potency.
Yeah,
What
potency is start with 30 because of the safe side 30, and you can repeat because these cases needs repetition. So once the repetition has to be there, the potency has to be lower. That is in the safer side. Once we start getting the response, you can increase it to 200, 1M, depending on the case, depending on the improvement you see with the patient. See, assessing the improvement is the doctor who's treating the cases. But for the safer side and for to repeat the cases, 30 to begin with. Yes,
Yes.
sir.
Yes, yes, Dr. Hibbert.
Thank you, sir. Very nice, very wonderful presentation, and I thank God for giving you. You had such an experience, and from that you made these wonderful, wonderful things to the world. We heard that Dr. Patel had cancer, and his hand was removed. After that, he became a great cancer patient, cancer doctor. So your experience made great things. But I want to ask you on two questions. Whether you use hydrogen peroxide and salt water for dressing?
No. Hydrogen peroxide has not been used because uh, these kind of ulcers at times it gives worst effect because of the hydrogen peroxide chemical at times. So I was little careful on that. I was little not that it has helped. Hydrogen peroxide oxide I use it. Turpentine and hydrogen peroxide I use if there is a maggot. If the maggot and the ulcers are there, I have many cases of little earlier times because we never had that kind of technology. Otherwise, I would have taken the videos and shown you the cases of maggot in a human leg. There, I have used hydrogen peroxide and this one turpentine, so that the maggots come out.
Whether you are using saline, normal saline, or
No, sir. We wash it with our rectified spirit. Clean it up with the rectified spirit.
okay,
Now I
sir.
invite Dr. Anil Kumar, our guest, our faculty for the Hindi session. Sir, you can talk. Dr. Anil Kumar, sir, who took a class just in the Hindi session.
Sunstroke class, I was there. I was listening to him, sir. Those are
Yes.
very good explanations.
Yes. Yes, sir, please unmute. And Kumar Singh, sir, please unmute and Rampari, sir.
Thank you, Dr. Dhanesh ji. Congratulations, Dr. SADAT SAIT ji. Very nice presentation. Deals ulcer case, gangrene case. Beautiful homeopathic medicine. Homeopathic medicine, great homeopathic medicine. According to case, I am agree, very agree. Gangrene case, carbo-based etc. medicine. Silesia 1M is a very good medicine, healing power of gangrene. Merxol, calendula is the external use. Very, very thanks, sir. Very, very thanks.
No, sir. No, thank you. We are learning from you, sir.
Now I invite Dr. Bob Lim to make his statements here. Dr. Bob? Yes, yes,
Can you see me or watch me?
yes,
I'm
yes.
sorry, I'm driving. I have to park my car to say something. Yes, I have to.
Yeah.
Just can you just hold on a minute?
Yes, yes, you can take your
It
own
was
time.
difficult to hear it. Is
SADAT SAIT.
Doctor
Sadat
SADAT.
sir.
Dr. Sadat? Is it Dr. Sadat? Okay, that's been a very informative session today, and you described very well about the treatment protocol using homeopathy for this for ulcer, and also using the snake venom to cure certain cases, and it is very informative. Even though I cannot hear very well inside my car, but I still catch a bit of it. And anyway, it is a very good session, and you have done very well in your presentation with all uh, the proving and this what you call the evidence based results. And on behalf of IFPH, I Bob Lim from Malaysia would like to say a very big thank you to you and hope that you can further share your knowledge again with us in coming soon webinar. Thank you very much. Over
Thank
to
you,
you,
sir.
Dr.
Thank you,
Danesh.
thank you, thank you.
Now I invite Dr. Masrina. Yes, Dr. Masrina, you can unmute yourself and speak.
Yeah, okay. Yeah, thank you. I was listening from the beginning. The presentation by Dr. Said. Said is very interesting, and again, that shows, the success stories of your treatment shows that the wonders that homeopathy can provide, and that gives the encouragement for all homeopaths to actually prove and show their skills. So thank you once again, Dr. Said, and I hope to hear more from you in the future. Thank you very much.
Thank you, ma'am.
Yes, that's how the
Dr.
session.
Dr. Danesh invites, will come.
Yeah, definitely we are here. You can present all those successful cases, just like you took these ulcers cases today. You can another day you can take your experience with the kidney diseases and the renal cases like that. Even bronchial cases, asthma cases. So day by day you can we can fix sessions. Our sessions will continue already. We have been booking. We have booking up to this June
Hmm.
30th. Only very few days gaps are there. Anyway, we will find a suitable date in between for you. Thank you, Dr. Sadas, for your excellent presentation in this day, in this evening. You really, all of us enjoyed. Not only we really enjoyed, but we studied a lot of things from that also. And you have shown the importance of diagnosis also. And we will be posting all these videos tomorrow itself, so that it will reach to more and more people who have no knowledge about homeopathy, and definitely some of the patients will reach in some of the doctors' clinic, not only at the clinic of Dr. Sadat, but doctors around the world itself. And that's the thing we can do for homeopathy. And tomorrow we will have a session from another big person, that is Dr. Jitesh Sharma, who is a person who is having so much of successful cases in his kitty, and he will be presenting some of the very good Materia Medica cases from Materia Medica. That's all about today. Thank you all for joining this session. And Dr. Ankumar Singh is there. Sir, do you want to say anything more? Please unmute, sir.
Very nice session, sir. Hello.
Okay, sir. And
Yes,
sir,
sir.
Very nice session and very experienced session. Homeopathic always do miracles in ulcerative use cases. Wow, wow. Thank you
thank you.
for sharing this type of experiences.
Thank you, sir. Always welcome, sir.
Okay, we
चलिए,
can.
thank you, Dr. Anil Singh को भी thank you, very very thanks. In this session is a very good session.
Okay,
Thank you, thank you,
with
thank
that,
you.
with that, we come to the end of the day.
Anil Singh is my friend.
Okay, sir. With that, we come to the end of the day 1361.